Okay, my friends, I was asked to talk a little bit about nasal polyps. So, which is the best way to do that? I figured out, let's use the stupidity of science and explain what is going on. Now, nasal polyps, overview. Nasal polyps are soft, painless, non-cancerogenic growths. Okay? They result from chronic inflammation and are associated with asthma, recurring infection, allergies, drug sensitivity, or certain immune disorders. Okay, so we are having always the same spiel, always the same false information, blaming inflammation on problems because simply the way the science we are being told is a baloney science, is a fake, has nothing to do with the truth. Okay, so symptoms, common signs and symptoms of chronic sinusitis with nasal polyps include a runny nose, persistent stuffiness, postnasal drip, decrease or absent sense of smell, loss of sense of taste, facial pain, or headaches, pain in your upper teeth, sense of pressure over your forehead and face, snoring, frequent nosebleeds. Well, all these, almost all of these symptoms are symptoms of inflammation, and we know that inflammation is caused is nothing more than forced hydration of dehydrated tissue, chronically dehydrated tissue, when there is a need of this tissue to respond to something, usually toxicity. Cells have to first hydrate to be able to push the toxic load out. Now here we are talking about polyps, which are like garbage bags, nothing else. We know that inside of the cell, when cell cannot correctly detoxify, it is going to separate the garbage and put it in a special lipid bags, and we call this mesosoma microsoma, and now they are blaming it to be a coronavirus. Stupid leads stupid. If there is more toxicity that has to be handled and voltage comes down because cell is way too acidic and toxic, cell will split in half and try to push all the toxic garbage in one side so the other side remains clean. We call this proliferation. If a tissue is experiencing these problems, it starts developing growths. These growths are full of toxic matter. On the skin, we call them warts. In the nose, we call them polyps. In uterus, we call them papilloma. It's all the same stuff. Okay, now seek immediate medical care when you have serious trouble breathing, sudden worsening of your symptoms, double vision, reduced vision, or limited ability to move your eyes. Now you see, this has nothing to do with nasal polyps. These are all signs of highly toxic blood. Swelling around the eyes, nothing to do with polyps. It is inflammation. Increasing severe headaches, inflammation of Mennings. Okay, causes. Scientists don't yet fully understand. This is why they make such a stupid claims and blame one symptom causing another symptom and neglecting the real culprit, toxicity. Because we are never told anything about toxicity in medical school. And we are being explained many processes of our body the wrong way. There's some evidence that people who develop polyps have different immune system response and different chemical markers. Of course, when body is toxic, environment changes, it creates different resonance which genes respond to, and they start guiding the cells into producing different things for better survival chance. Okay, risk factors. Conditions often associated with nasal polyp include asthma, of course, dehydration and toxicity of lung tissue, aspirin sensitivity. Well, aspirin sensitivity. You are sensitive to many things when you are dehydrated, which actually causes allergies. And here we are, allergic fungal sinusitis. Fungus does not cause nothing. It's the inflammation and garbage accumulation which fungus goes to munch on. Cystic fibrosis, I have explained before what fibrosis is severe dehydration of a tissue where actual collagen fiber starts showing up as a white net. Okay, now we have here mentioning of another disease, Creutzfeldt syndrome. Inflammation of blood vessels. Well, if you have dehydration on a cellular level, it is going to affect all the cells in the body because it's caused by toxicity. When blood is toxic, then cells do not hydrate. Vitamin D deficiency. Yeah. Okay, complications, okay, sinus infection. Okay, when we are talking about infection of sinus, well, when area is very toxic, you have bacteria showing up to munch on those toxins. Prevention. Manage allergies and asthma. Yeah. With what? With medication? Of course. Anti-inflammatories, antihistaminics, steroids, of course. Avoid nasal irritants. Nasal irritants. Practice good hygiene. Wash your hands regularly, thoroughly. How about this? Humidify your home. Well, we can gain some water through vapor, but you don't get salt. So you are eliminating it. It does not help you much. Nasal rinse with salt water. Here we are. Oh, the only thing here that is worth something. Okay, diagnosis is made based on nasal endoscopy, imaging studies, allergy tests. Allergy test is a test for cellular dehydration, but doctors have no clue. Test for cystic fibrosis. What a nonsense. Blood test, yeah, but nobody is checking level of plasma and toxicity. Treatment. Chronic sinusitis, with or without polyps, is a challenging condition. Of course, a challenging condition because we are blaming one symptom of causing other symptom. So we focus symptomatically to deal with the symptoms, multiple, and we are actually poisoning the body further. Medications, nasal corticosteroids, of course, oral injectable corticosteroids. The worst thing you can do is a long-term steroid use. These are not treatments. Well, they are symptomatic, suppress the symptom, which will work for a short time, and then it will not work anymore, and you have bigger flare-up and bigger problems. Of course, when the problem gets big, then surgery. Cut this thing up, and what happens? They grow back because the tissue is toxic. Okay. So as you can see, nasal polyps have nothing to do with what we are being told by our doctors, by our science. Nasal polyps are basically bags created to house toxic plasma. Since mucosal tissue is organ for cleansing blood, then when toxicity of the blood increases because kidney cannot handle it, then we start eliminating toxins through mucosal tissue. And mucosal tissue encompasses respiratory and digestive tract. And this is why you are not going to see only problems in the nasal passages when you have nasal polyps. You can have problem also with mouth. You can very well have problems also with digestion. But dehydration of the tissue is a pretty big problem, which causes variety of problems that I have explained, being it on muscular level, being it on respiratory level, digestive level, bone level, joint level. And this is why when you have a severe cellular dehydration and let's say polyps, nasal polyps show up, you may also experience other problems, as I have just mentioned now. So you can have a pain, you can have a headache, meninges is dry, so it goes into forced hydration. It inflames, causes more pressure on sensory nerves. There comes headache. When you lose sense of smell and taste, well, because the tissue has inflamed. We saw now with this Zumzula crown thing, because of which we have to be all masked and receive those things. It is all farce. All is farce. So, if you have a problem with nasal polyps, well, you have to go into hydration. You have to hydrate and cleanse. This is treatment. Doctors never ever do cleansing. And I doubt that they are so stupid. They know that by cleansing, you eliminate symptoms. You eliminate symptoms, you lose patients. So it's not being done. I can't wait for this system to collapse. All the licenses go away, and then have true healers do the healing. If you suffer from nasal polyps, follow the self-healers protocol. Simple. But be aware that at the beginning you are increasing toxicity, so things will flare up. And this is why you can misinterpret symptoms. This is why I always say, if you are medicated or if you suffer from some chronic health issue, ask for guidance. Yes, you can heal yourself if you follow the self-healers protocol, but very often, because of our programming, we explain our symptoms the wrong way. We become afraid and we start improvising, adding more things from the incorrect science, and healing is impossible. So be strict with the protocol and ask for guidance. The biggest problem that I see, again, is with vegans and vegetarians, because they are extremely, extremely dehydrated on a cellular level. And when they start hydrating, the body cannot really function. So they become bloated. They get nauseated. And they say, well, I cannot drink more than, I don't know, 2 liters, 3 liters of plasma because I get nausea. Well, you get nausea because you start cleansing. And if the toxic load is very high, the toxic mucus that settles in your stomach, body is going to make the decision. Is it okay to process it, or shall we just eliminate it right here and then? So if you get nausea, vomit, get rid of the stuff. You are cleansing. Every shaman, every healer, natural healer, when we skip the indoctrination of the modern society and we go to indigenous people, a healer heals through purging, through detox. And of course, healers have much better results in healing than modern physicians do. So, this is black and white. So if you have a problem with polyps, do the protocol and give it time, because you are going to, especially if you have been vegan or vegetarian, it will take time and it's not going to be easy. It is tough because highly dehydrated, highly toxic on a cellular level, and when these toxins start oozing out, you may be bloated, you may be holding water, have water retention. The systems are not working correctly, high toxic level. And gradually you get better, but you have to persist. You have to follow the protocol the way it's written, not improvise. Oh, I cannot drink more than 2 liters of plasma. Well, if you cannot drink more than 2 liters of plasma, you are going to suffer more, because you're going to start releasing the toxins, which you cannot then eliminate because you don't have enough water. We have to drink much higher quantity of plasma, at least 3 to 4 liters daily, and then watching our stool, and if there is some hard elements in the stool, increase plasma. Even if you still have diarrhea, but there is a hard formation, it means the diarrhea is the toxic mucus you are eliminating, and the harder things are dehydrated excrement, because body is trying to soak back into circulation every drop of water. So drink more plasma. Just yesterday, I was hit with strong detox. Always happens after my ayahuasca. And got headaches, muscle pain, skin sensitivity, fever. And when that happens, right away went for homeopathy, using my breath, then preparing the plasma and pushing the information also into the water before drinking it. And drank water plasma, so I was urinating constantly, every 1 hour, even during the night, could not sleep well. But then I hit the point of slight sweating and everything calmed down. So the detox was strong, but when you handle it correctly, it rapidly goes away. Drink a lot of plasma. More symptoms you have, the worse you feel, the more plasma you have to drink, because you feel bad because your blood is toxic. So keep helping your body. Provide a lot of plasma so there is a water and the body can detoxify. If you are getting nosebleeds, well, this is one of the ways how body detoxifies. You are not having nosebleeds because of the polyps. You are having nosebleeds because of the toxicity of your tissue. Thank you for listening. And on we go with our discovery of truth. Love you all. Namaste.